Hi there. My name is Dr. Akshay Yadhati. I'm one of the orthopedic spine surgeons with Ortho Rhode Island. I'm the newest addition to the team. Nice to meet all of you. I thought, especially with a lot of patients, being at home, probably working from home more often than not, it'd be probably nice to kind of talk about degenerative disc disease. Maybe your back or your neck is a little bit more sore, and you're wondering about those degenerative discs and those disc bulges that some of you may or may not have, or might know about based on a prior MRI that you've had in the past. So I thought we'd kind of spend some time to talk about that. What I'll tell you about degenerative discs is, in and of themselves, they tend not to necessarily mean that you need to have some sort of big, radical surgery or anything like that. The discs, in and of themselves, are essentially built like jelly donuts, and they're basically a series of shock absorbers that are stacked in between each of the vertebrae in our back and in our neck. And again, they're kind of situated and set up like jelly donuts. The inner central jelly portion of the disc is the kind of well-hydrated, sort of bounceable material. And the outer dough ring, the job of that is really to keep it all contained, to keep all that jelly kind of centralized and contained. The disc, especially once you get into your adult years, doesn't really have a great nutrient supply. When you're still growing and when you're younger, the disc is directly fed by a small little blood vessel. But once you get into further into your adult years, that blood vessel goes away. So the disc really only gets its nutrient supply by whatever is going to leak across the bone surface from the bone above it, and then whatever is going to leak across the bone surface from the bone below it. So again, when you kind of consider the fact that it doesn't have a great nutrient supply, what you should also know is that as you start to age, and especially once you get into your kind of late 20s, early 30s, and progress from that point on, that central jelly portion does start to dry out. And as that central jelly portion of the disc starts to dry out, it puts more stress and strain on the outer dough ring. So the disc can gradually flatten, and it can also slightly bulge. With those kind of two processes kind of going on, you can get occasionally sometimes some small little tears in the outer dough ring. Sometimes the central jelly can actually kind of protrude or herniate through that small little tear in the disc, and sometimes that can cause pressure on the nerves that live just behind the disc. Now, when you're thinking about a disc herniation, or when you're thinking about degenerative discs up in the neck, the symptoms that are definitely worrisome are kind of shooting pain symptoms that go down an arm, or what we worry the most about is when the degenerative disc process sort of starts, does it lead to bone spurs and arthritis? And the fact of the matter is, it can. When those bone spurs and arthritis in the neck start to kind of encroach and make the spinal canal narrow up in the cervical spine, we worry about things like dropping things with your hands and worsening balance. So I would tell you that those types of symptoms are probably reasons to seek treatment, or at least evaluation by a spine surgeon. But I'll tell you that for isolated neck pain, and especially the pain that can kind of go up just at the base of your skull and then down kind of in between your shoulder blades, that tends to be sort of a symptom that we try and get better with anti-inflammatory medications and physical therapy to try and get those muscles to feel better. And that's sort of a similar thing, especially when we start talking about the low back. When those degenerative discs and the subsequent arthritis that can develop, because the disc degeneration is sort of the first step in the process of developing arthritis in either the neck or even in the low back. Midline low back pain is something that we really do try and be conservative with. It's not necessarily something that surgery is ever going to be a great first option for. Those, again, that midline back pain is something that we really do try and get better with anti-inflammatory pain medications and physical therapy. But the worrisome symptoms that I would say that should definitely prompt you to be seen by a spine surgeon or a specialist is surprisingly any kind of difficulty that you're experiencing with loss of control of your bladder, or loss of control of your bowel movements, or numbness and tingling in the groin region. The sort of scenario to be mindful of is when you basically spontaneously lose control of your bladder without your brain having any warning sign that you had to go to the bathroom before that. The reason things like that can happen with degenerative discs and all of a sudden really quick or rapid disc herniations that press on the nerves is that it can cut off the kind of communication between the bowel and the bladder region and your brain. So all of a sudden, with that disconnect, your bladder can fill and fill and fill and start to just basically spill out of the kettle. So that is something that I would say definitely actually, that specific scenario should actually warrant you to get over to the emergency room. But the other sort of symptoms that we can help patients with are shooting leg pain that goes down from the back, or weakness in an extremity, or numbness and tingling that goes down that leg. I'd say that spine surgeons can help patients when disc issues are causing extremity symptoms like shooting arm pain or weakness in an arm, or shooting leg pain, or again, weakness in the leg. But when it's midline neck pain or midline back pain, those are the scenarios that we really do try and get patients better without being too aggressive with any kind of surgery. So hopefully that sort of kind of broad little discussion maybe it answered some of your questions. I hope that it certainly was helpful. But understand that we're here for you and happy to see you and kind of answer any more of your questions and try and help get you better. All right, stay safe and take care. Thanks. Bye.